Metastatic bone disease poses a high risk for skeletal related events, including pathologic fractures and spinal cord compression, which lead to higher mortality after definitive surgery. Estimation of survival is important in treatment of metastatic pathologic fracture to help set patient, family, and physician expectations on prognosis. This is a survival analysis of patients with pathologic fracture from metastatic bone disease in a single tertiary center. The presence of a pathologic fracture leads to a higher mortality rate after definitive surgery, reaching 60 to 83% at 1 year and 70 to 94% at 2 years. Estimation of survival is important in treatment, and among the different hematologic and serologic parameters previously studied, hemoglobin, ALC, and serum albumin are those that have shown significant results. Preoperative anemia is a strong negative prognostic factor and an indicator of survival in MDD. Low ALC indicates poor wound healing and higher morbidity in postoperative patients. Low preoperative albumin status has been correlated with poor postoperative recovery, with a significance in predicting cancer survival and in prognostication in patients. With local ethics committee approval, we conducted a retrospective cohort single tertiary center study involving patients diagnosed with pathologic fractures of axial or appendicular skeleton, treated surgically and non-surgically between 2010 and 2020, and evaluated for hematologic and serologic risk factors for mortality. Here are the inclusion and exclusion criteria, as well as the algorithm for data collection. The mean age of respondents was 60, and mostly were female. Comparative analysis indicated that the mean age of the respondents who expired was significantly higher than those who were alive. The primary malignancy was found to be most common in the breast, followed by the lung and the kidney. And in patients with lung cancer, the proportion of those who expired was significantly higher. It was noted that those who expired within the first 6 months from the time that MBD was established compromised those with low preoperative hemoglobin and low serum albumin as compared to those who expired within 1 year. This, however, were not statistically significant. To those who survived beyond 1 year, only 1.75% have normal albumin, and this is due to the study population's low albumin levels, which shows that despite this, survival rates did not differ significantly. In terms of surgery, results also show that 85.16% of the respondents had surgery, and the proportion of patients who survived within 6 months and had surgical intervention was not significantly different than those who expired and had surgery. Preoperative or postoperative chemo or radiotherapy, as well as the site of visceral metastasis and the presence of other bony metastasis, did not have significant impact. 40.63% of the respondents expired within 6 months, while 14.84% expired within 6 to 12 months, and that the median mortality time for patients with low markers was within 6 months. Cox proportional hazard regression analysis of the predictors of mortality showed that the adjusted hazard ratio of mortality among those without surgery was 25% higher among those with low preoperative hemoglobin and low ALC than those with normal values. In addition, results indicated that low serum albumin was not associated with the hazard of mortality among those without surgery. On the other hand, results revealed that the adjusted hazard ratio for among those with surgery and low preoperative hemoglobin and low serum albumin were 31, 20, and 45% higher respectively than those with normal serologic results. The time from diagnosis and/or surgical intervention to mortality was earlier among those with low preoperative markers and those without surgery. Common significant risk factors of survival is the site of primary cancer leading to the pathologic fracture. Preoperative serum albumin, lymphocyte counts, and hemoglobin levels were all found to have a higher risk for mortality in this study, however, not statistically significant. Although other reports have showcased preoperative hemoglobin levels as the only independent predictor of survival, not one study reported all as a significant risk factor for mortality in MDD. No significant difference in terms of mortality was found between the operative versus non-operative group, and these findings again reflect those patients are already in the terminal stage of the disease owing to its low survivability. In conclusion, primary tumor is an independent prognostic factor of survival in patients diagnosed with pathologic fracture from metastatic bone disease, treated surgically or non-surgically, with primary lung malignancy as having the poorest chance of survival. Preoperative serum albumin, hemoglobin, and ALC were not found to be significant in predicting survival, but may still be used as a determinant of nutritional and clinical status of patients contemplated for surgery, which may affect clinical and surgical outcomes.